Knock knock. Hello, first I'm going to identify myself. My name is Michael Arthur. I'm a student nurse from Nevada State College and in hand hygiene. Also, while you're introducing yourself. And then since he can't talk, I'm going to have to check his wristband for his identity. So his name is Miguel Garcia and his date of birth is 11/25/1990. And that's good. So now I'm gonna assess him, check his skin color, his breathing pattern, and his oxygen level is 96%. And are you feeling any pain right now? So he's not feeling any pain and he's good. So make sure that you thumbs up if you're feeling okay and thumbs down if you don't feel comfortable, okay? Alright, and now I'm gonna have to prepare my supplies, make sure everything is here. I have my vacuum here, and make sure that I do my semi-pelvis position for my patient before I do my tracheostomy suction. So now I'm gonna grab my catheter, my suction kit, and check for expiration or any moisture or if it's open. And this one looks good, and I'm gonna have to. I have an extra gloves here just in case my other strap glove is not it's not the right size for me. So now I'm just gonna open this. So since this is too small for me, I can't use this one. And I'm gonna prepare this and prepare my saline water or my sterile water. Make sure this one is open. That's good. And now I'm gonna open this. So I'm gonna open this. And also make sure your sterile water and the label is good. Make sure it's not expired or you have the right concentration or solution. It looks good to me. So that's good. Now I'm gonna have to open this. This is my sterile gloves. Make sure you have the right size of sterile gloves. Okay, now I'm gonna put this on. Make sure you're not contaminating your sterile gloves. And now you can do this and just fix it. Now this is good. And just you can move this if you want. No, this is this has to be sterile. So because this is going inside your patient's tracheostomy tube. So make sure you don't contaminate this. So now I'm gonna have to grab. So this will be my non-sterile hand, and this is my non-dominant hand. I'm gonna have to grab this. So I can connect this with my one hand. So make sure you're not contaminating anything. And then just grab this here. And you can roll this on your hand. And make sure that you have, make sure you're not contaminating the tube. So now that you have this on, just check if this is working. It looks like it's working. Alright, so that's good. So now I'm gonna have to go in here. And since we don't have the oxygen mask here, but make sure that your patient has an oxygen mask, and make sure that it's all smeared on his tracheostomy tube, at least 10 liters, so it will reach his tracheostomy tube and it will help him breathe, and also moisture his tracheostomy tube. Alright, Mr. Garcia, let me know if you don't feel comfortable, okay? So just relax for me and then deep inhale. And I'm gonna go inside. Make sure you don't contaminate this, you just go around for now. Make sure you have this flat. So you're going in for at least 5 to 6 inches and stay there, suction his tracheostomy tube for 5 to 10 seconds. So now, so Mr. Garcia, I'm going in, okay? Just 5 to 6 inches. And that's alright. Oh, that's good. now you can clean this one. After you clean, you can do one more time. Make sure you're not going to contaminate this because this will go inside. So I'm going again, Mr. Garcia, okay? Just relax. Okay. So 5 to 6 inches and 5 to 10 seconds. And after that, just curl it when you're going out. Alright. It's good. And once you're functioning and everything's good, just after this you can go ahead and take this off and dispose everything you don't need. So after that, make sure you dispose everything and put him back to supine position, and then reassess him, check his skin color, his breathing pattern, and his oxygen right now is 98%, and that's good. But Mr. Garcia, I'll be right back, and give me call if you need anything, okay? And make sure you document everything on the computer. And that's it. Hello. So after sanctioning, now I'm gonna have to do a trach care. So first I'm gonna put on my clean gloves. So Mr. Garcia, I'm back, and I'm gonna have to do a trach care, okay? I'm just gonna have to take off your gauze on your tracheostomy tube and replace it with a new one. Alright? How you feeling? Alright, sounds good. And now make sure you assess him for skin color, anything, or any abnormal findings. So far he looks good. And just to make sure, just double check his identity again, and make sure it's the right date of birth and name. And now just semi-polished position again also for cleaning. And I'm gonna take this off. Just give me 1 second. Alright, thank you. Now this one I can put this away and dispose this. So that's done. And now after that I'm gonna do a hand hygiene and prepare my trach care kit. So this is my trach care kit. And make sure that it's not expired or no moisture or and it's not open. So this one is good. So right now, make sure that I have my oxygen on him before I start. So I don't have any oxygen mask, but just make sure that you have an oxygen mask here to hyperoxygenate the patient and make sure they can breathe, and at least 10 liters, so it will reach the tracheostomy tube on him, and make sure that he can breathe while you're doing it. Just make sure you're aware on his condition. So right now, just there's a mask here for his oxygen. Okay, now I can open this. So I can put on my gloves. Before I put on my gloves, I can go grab this and put this on his chest. Make sure you have the right cup end here. Now this can be sterile filled also, so you can go put all your stuff in here, like your gauze and. So you have this. You can go grab this one and put this on. Make sure you have the right size again. So if it's too tight, you might contaminate the gloves. But hopefully this will fit. Okay, it fits. So next is this.
There should be some in the drawers right here.
Right now you're good on this. You can go grab the gauze and put this on here. Make sure you're not contaminating the gauze. And now you can grab the peroxide solution. It comes with tube solution, and now you can go grab this. And just make sure you prepare all your stuff. And since these are all sterile and this is a sterile kit, you can go ahead and put this on here. Make sure you're not putting these ones are not touching any unsterile objects before you use them, especially the Q-tip. Okay, so now this is gone, and I can go throw this away. And this one is good also, so I can throw this away. And now I can go ahead and open my saline and make sure you have the right label and everything. So this is good. It's not expired. So if you open this, you can go ahead, because you're gonna use all these, so you can go ahead and throw all these away. Good, we can go. So this will be my non-sterile hand. This is my non-dominant hand also. So I'm gonna move this here. Make sure it's right there. And I'm gonna move this the inner cannula and soak this to the half and half solution, which is peroxide and sterile water. So while I'm doing this, I can go ahead and check the tracheostomy tube if there's secretions outside, so I can clean this side here. Don't go inside the tracheostomy tube because that's not good. That's inside. That's a sterile area. So just the outside part and this part also. Make sure that this area is good and clean. Alright. So after that, you can throw this away. And then now we can use this gauze to clean the outer side of our patient's stomach. So just go around here and clean this. Make sure there's no secretions or any dry mucus on it. And while you do this, make sure you assess it and see if there's blood or anything that's abnormal or not. That's not right on his tracheostomy tube. So check it. So now it's clean. Make sure it's all clean and it's all dry. Now I can go ahead and clean this inner cannula with the scrub. So you can go inside here. Make sure you're not holding this because this is a sterile area. Because this will go inside our patient tracheostomy tube. So you just hold this part out here because this is not sterile. Just clean it. And after you clean it, you can go ahead and rinse that. There. So just make sure you're rinsing it good. And while you're doing that, we can go ahead and go put this in. Okay, so this is good. So I'm just holding this part.
Okay, so
just stop it.
One hand dirty, one hand.
Make sure it's not too dry because the water can be moisture and might lubricate the tracheostomy tube. And not too wet and not too much water in it because to prevent aspiration on our patient. So after that, maybe you can just tap it with a sterile gauze. Just tap it like this, dump it. Okay, so that's good. It looks good to me. Make sure it's clean, check it. Alright, that looks good. This can go away. This goes right here. And just like that. So that's good. Everything looks good, so now we can put this gauze on this new gauze on the tracheostomy. This to prevent it, just in case there's any secretion or mucus going out the trachea, or blood maybe. Hopefully not. So just like that. Make sure it's good. Make sure it's good, and don't use scissors to cut this because of the fiber. It might affect the patient's tracheostomy and his breathing. So make sure it's all good. And do you feel comfortable, Mr. Garcia? Good. I'm almost done, okay? So just let me know if you're feeling comfortable. Make sure that you have your oxygen here close to him. And make sure it's at least 10 liters per minute, so it reaches the tracheostomy and moisten it, and it helps him breathe. And you make sure that you hyperoxygenate your patient before you do the tracheostomy care, okay? So after that, now we can go ahead and change his band with this. So this can go here. I'm using the slip knot tie, make sure it's all even. Almost done, Mr. Garcia. Are you okay? Alright. Just relax. I'm almost done. You're doing really good.
So like when you open your thing,
So I'm gonna go ahead. It's just a little uncomfortable on this side, okay, Mr. Garcia? But I'm almost done.
yeah. So you know, that's how you say, well, say these are the gloves you use. You can just pinch the back of the glove. So they'll be like this.
So that's it. Make sure you do it gently and not pull the patient's tracheostomy tip because that will might hurt them.
And as long as you don't touch anything inside, and you just pinch the top, you can take the gloves out.
Okay.
The glove, the outside of the
Just go ahead over here. Excuse me.
So then next is this, and you can take this out. And then, yeah, don't shake it, but you know, you got that 1 inch water and you can open it. And then you lay that out as your sterile fluid, and then you can just dump that stuff.
No, but how it says 4 years old.
You can't do that.
And then
But the other thing, the other way you would do, if I say all this stuff was separate, then yeah, you can go ahead and do that. But for this pass off part, you have to pretty much dump everything on your sterile fluid, put your sterile gloves on, and then manipulate everything you can to. Right, but I mean, right, one hand becomes dirty once you
I'm
touch
sorry,
the
Mr.
patient.
Garcia. I'm almost
But until
done.
then, pretty much both your
Here we
hands
go.
are
I got it.
sterile, so you can manipulate your fluid.
And just make sure you tie this and at least
After you do that, you
two
gotta set
fingers
up, you know, okay, this is
gap on this, so it won't be too tight and won't be too loose, okay?
Yeah. I mean, like, when it comes separately, yes, you can do that, but with how our kids are made, you can't.
All right. So now it's good. How are you feeling, Mr. Garcia? Thumbs up if you're feeling good. Thumbs down if you're not. Good. Thank you so much. Now make sure that we put this back here, so he can breathe, and assess him again. Reassess him. Make sure he's doing good. His breathing sounds, skin color, and everything. Okay. So I'll be right back, Mr. Garcia. I'm just gonna clean all of this stuff, and I'll go assess you more. Okay. Thank you so much. You have a good day. Now I'm gonna have to document it and make sure everything's on the computer after this procedure. Thank you.